My name is Dr. Neil Long and I'm an emergency department physician at Burnaby Hospital. When the COVID-19 pandemic hit British Columbia, it was like a hurricane. While a stunned community was trying to make sense of what was occurring around us, medical staff were working extremely long hours, afraid to go home to their families for fear of passing on the infection. There was a shortage of personal protective equipment and we barely knew what we were fighting. But at Burnaby Hospital, I couldn't be prouder of how well our medical and support teams came together. Working in unison with administration and our medical authorities, we dramatically adapted our workflow and processes and even our workspace. At a time when we were communicating with colleagues everywhere, scouring the literature to determine the best practices for managing our COVID patients. And while all this was occurring, our wonderful community was coming together for us. And at a time when there wasn't even toilet paper left on the store shelves, donors to the Burnaby Hospital Foundation contributed 100,000 pieces of PPE, 13,000 meals and snacks for our exhausted frontline staff, and raised over $700,000 for the COVID-19 Emergency Response Fund. And that money has been used to purchase life-saving equipment such as ventilators, updating all our airway equipment, and multiple ultrasound machines to care for our patients on the front line. But for all that we've achieved so far, the fight against COVID unfortunately is not over. In some respects it may never be, and to me the lessons have been learned and the path forward is clear. We must, in a word, be prepared. It's so critically important that we have the tools, the resources and the facilities to provide the best possible care in a safe and sustainable way. This is how we move into a beyond COVID world, ready to protect ourselves, our loved ones and our community against the next pandemic or the next crisis that will inevitably someday come along. And this is why right now Burnaby Hospital Foundation is raising funds to rebuild Burnaby Hospital. The redevelopment, once complete, will include 2 new patient care towers, a cancer centre, new equipment, and upgrades to all the areas of medicine, including emergency, maternity, surgical services, and mental health. For the ER itself, we're going to see a 10,000 square foot expansion with more equipment and dedicated space for isolation and treatment of infectious diseases. These changes will turn our little community hospital into a world-class, state-of-the-art healthcare campus. So please give generously right now to support the transformation of Burnaby Hospital, and with your help, we really will build a brighter future in healthcare in Burnaby and beyond. So from all of us at Burnaby Hospital, we thank you, and I want you to remember that what you do matters.